Hello, guys. Good day. This is Anna of Reinforce Big Love. Today, we are going to talk about one of the most dangerous, rampant, terrible communicable disease in the Philippines, dengue fever. Yes, I know mom and dad, parents, grandma, grandpas, they all know how awful the experience of having a possibility of dengue mosquitoes in the environment, in the community. This this particular disease is being transmitted from an infected mosquito into human, or from an infected human to a mosquito, vice versa. So the name of the mosquito is Aedes aegypti. This is a female mosquito. Once they bite, that's the start of a challenging story, especially for children. When you happen to encounter these cases in the hospital, this is quite heartbreaking when you see a young child fighting for his life. This dengue fever virus has four serotypes, and this is common in the tropical and subtropical climates. One of this is Philippines. So yeah, this disease is common in the Philippines, and I'm pretty much sure that the healthcare providers can able to accommodate and immediately intervene if they find out that the 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 cases, if there are any outbreaks, or if the patient has all the signs and symptoms in the checklist, they can able to manage it well. So kudos to all the doctors and the nurses in the Philippines, all of the healthcare workers, DOH. Thank you so much for doing something about this. Now, the signs and symptoms of dengue fever, you have to look after the first sign, which is the febrile phase, in which a child may experience high temperature or high fever from 39 to 40 degrees Celsius. Sometimes when they happen to find out in the late phase, there's no more fever, but there is already a presence of bleeding. Another symptom is, the kids complain of pain behind their eyes, muscle weakness, joint pain, abdominal pain, vomiting, and nausea. Usually, the bleeding occurs, the attack of the virus occurs in the gastrointestinal area. It's where you can see visibly the hemorrhage happens. Now, we got four stages of dengue fever. Number one is the infection phase. This happens where the child experiences high temperatures, and they are also positive for the tourniquet test. So tourniquet test is being done by the doctors and nurses to check if there is a drop of platelet count to a patient. But this is not official. There has to be some sort of diagnostics involved, like serology and identification of the dengue virus, which is NSI or PCR. So the doctor decides for it. At this stage, the nurses in the hospital is vigilant enough to note any signs of bleeding by checking the quality of pulses. Usually, if there is a presence of internal bleeding, the quality of pulse is rapid and weak. As well as the nurses, the healthcare workers, not only the nurses, sorry about that, they take note for any signs of bleeding, like when a child vomits with blood, or presence of blood in the stool, which is called melena. So in the first phase, there's no signs of bleeding yet, but the healthcare workers are quite vigilant enough to really look at and observe and take note any single signs of bleeding. At that moment, the doctor starts to really uh, buckle up a couple of fluids, IV fluids for rehydration. Whenever the patient also feels feverish, or yeah, with the presence of fever, the body also dehydrates. Now, in the second stage of dengue fever, dengue hemorrhagic fever, now this is the time when the hemorrhage uh, shows up. So with the fever, on and off fever, from first day to 7 days, first 7 days incubation period of the virus in the body, there will be signs of petechiae on the upper extremities and rashes over the abdomen. Also ecchymosis, and the child starts to manifest some bleeding in the stool, as well as sometimes they vomit. Their vomits have bloods, and their blood count also starts to, their hematocrit count starts to rise above 20%. And from the first stage, I almost forget about this, which is the infection stage. The WBC also increase. So this time, it's still up in the second phase of dengue fever. And since the hematocrit is up, there is a possibility of decrease of albumin. Now, this is the critical challenge starts. The healthcare workers, the healthcare providers trying to cope up, to catch up with the missing fluids. If they need to transfuse platelets, they have to. Any blood products needed, and fluids. Fluid. Until the antibody existing in the patient's body will flip the switch and fight infection with the treatment that they get in the hospital. So same thing, since there is already, in the presence of decrease of albumin in the body with this virus, there would also be a possibility of pleural effusion because of the leakage, because of plasma leakage, or it could be ascites. Now, at this stage, also, some patient will manifest enlargement of liver, because the virus is starting to attack the liver or spleen, splenomegaly, hepatomegaly. That's the clinical term. Now, in this third stage, which is more like a war already against the virus, dengue virus, the dengue shock syndrome phase, the critical part. At this stage, as much as possible, they bring the patients in the ICU. So the quality of pulses this time is rapid and weak, and drop of pulse pressure. Because there's a drop of blood pressure at this stage, hypotension, as well as the pulse pressure, which is 20 mmHg or 10. Sometimes it's palpatory. And the best part is, once the antibody, with all the treatments and interventions provided by the healthcare provider, can able to catch up in this stage, the blood count, the hemodynamics status of the patient starts to stabilize. In the first 2 days upon admission, that's sometimes the platelet abruptly goes down. If the patient is being brought late, or if the progression of the infection is quick. And sometimes we can also see people recovering from this disease, which happens to be in the third stage, or not necessarily that they have to exhibit signs of hemorrhage. Sorry about that. We actually pronounce words in our own way with my pals, so that's why I talk like this. So hemorrhage, not necessarily that they have to evidently uh, sh- show up those signs and symptoms physically. They actually now the immune system can actually catch up at any stage in the dengue fever progression. But it's so fulfilling to know that even in some critical conditions in which a couple of blood products has been uh, introduced to a patient plus fluids, in the worst case scenario, there are still children who survived dengue fever shock. Now, if there is further progression of the infection, that actually happens when the patient starts to exhibit circulatory failure, in which the pulses are non-palpable and as well as the blood pressure is palpatory, and that's really the crucial part. Now, how does the dengue fever virus Aedes aegypti kills you or kills a person, an infected person? Now, by the time the mosquito bites the skin, Aedes aegypti, they start to spread out on the from the skin up to the nodes, attacking, and then afterwards attacking the vital organs. So once they are spread circulatory wise, which is called viremia, in a further notice, there will be some like sort of detrimental immune response if our immune system cannot catch up, cannot fight the virus. Plus, in a further stage, the our body's immune system will have this defective immune response due to the virus. The virus spreads out in the circulatory system, spreads out, infecting the immune system as well. And as a result of that, that's the start of plasma leakage, thrombocytopenia, coagulopathy, and the worst case scenario is the disseminated intravascular uh, coagulation, which is bleeding all over the place. Terrible. Now, how does the Philippine community, so I'll just talk about Philippines because I live in the Philippines. How do they respond? Which is evidently there, present, and can be viewed online, and also you can also go to the institution. So since this is existing in some parts and rampant or epidemic in some parts of the Philippines, the government actually do surveillance of the number of cases as well as the diagnostics and the management that were being used by the hospital, so that they can figure out which one is effective. And yes, some management will really work out. Everybody is doing their best. And for that reason, since we have surveillance, they can come up with the management against this disease. They can immediately intervene during outbreaks. Outbreaks happens when the weather is terrible plus the flood, because that's where the couple of stagnant dirty water is being stuck somewhere else. So in the stagnant water, it's where the mosquito breeds, so we have to clean that regularly. And another thing that the government did, they actually promote they have promote and displayed advertisement for advocacy to fight dengue fever. And for further studies, yeah, they were able to come up with some research, which is available online. And yeah, as well as the dengue fever vaccine, which is available for children, but it's not 100% shield against this virus. Now, what can a community do? Every person do to fight dengue fever? Since we already have the awareness and we've been victim of this disease. So, number one, which is somehow, I know it's already been done, use mosquito repellent. Secondly, wear protective fittings, long sleeves, long pants, especially those people who are planning to have activities going to climb certain mountains in the Philippines, which is great. So make sure that you have the proper gear as well as the best uh, clothing applicable for that activity because there'll be loads of mosquitoes there. Third is it's important to clean up and cover the water container on regular basis so that the mosquito cannot able to use them and use them in a way that they can breathe on that stagnant or stocked container with water. Number four is use mosquito net. Yes, this is commonly used. Yeah, mosquito net. I am also using this. I personally use mosquito net in the Philippines. In fact, and the matter of fact is, I love mosquito net since I was a child, and I find it hard to get away to not use mosquito net, even if in my adult age, until such time that I decided to go abroad and then I'd say goodbye to my mosquito net. Now, number five, consider putting screens on the window and doors so that any insects, mosquitoes, or flies cannot go into the house. Number six, dispose waste properly. Number seven, drain and clean up the gutter uh, to avoid the buildup of water. Water stagnant in that gutter, which can be used by mosquito, where they could breed and multiply and infect the people in the surroundings. Lastly, number eight, take note of the early signs of dengue infection, which is the febrile phase. But if you're not sure about these signs and symptoms that has been experiencing by your child, bring the child immediately to the hospital or clinics to make sure and to have immediate intervention as necessary. We'll never know. Prevention is better than cure. Now, once again, this is Anne of Reinforce Me Club telling you, you never lose, you either win or learn. Have a lovely day ahead, and thank you very much for your time.